Guyana, like many other countries still greatly affected by the COVID-19 pandemic, is aiming to achieve herd immunity during its COVID-19 vaccination campaign. Herd immunity occurs when a large part of the population of an area becomes immune to a specific disease. In the context of COVID-19, it means that if a large percentage of the Guyanese population is vaccinated and becomes resistant to the cause of the disease, the virus which causes it has nowhere to go. A key indication that a country might be heading towards herd immunity during its vaccination campaign is a steep decline in COVID-19 cases over a specific period. The task of vaccinating an estimated 786,552 Guyanese will be shared between local, private, and public hospitals, according to Minister of Health, Dr. Frank Anthony.
And our intention is to, once we get the vaccine into Guyana, and even before we get the vaccine, that we will also be conducting training with them pertaining to the vaccine. We'll get them to dedicate special staff that we can work with and train to give these vaccines. And it's not only the private hospitals, but we intend to also work with private physicians to make sure that this vaccine, when we get them, can be quickly rolled out.
The minister added that apart from administering the vaccines, private healthcare providers will also be entrusted with tracking persons who were inoculated.
They'll have to make copious records for us and pass that back to the national program, and they would also have to do some monitoring for us and present those records to us. And once they're compliant with that, we will be rolling out vaccines to them as well.
With just a limited supply of vaccines being provided by the COVAX facility, government has begun exploring additional sources to attain enough vaccines to immunize a significant portion of the population. Those first in line to benefit are healthcare workers, frontline workers, persons with comorbidities, and the elderly population. March 11 will be 1 year since the first imported case of COVID-19 was detected in Guyana. As of January 31st, there were a total of 7,641 confirmed cases countrywide, with 176 deaths. Temika Rodney reporting for the HGP Nightly News.